What secrets do colon biopsy cells reveal under a microscope? Imagine peering into tiny cells that hold the key to understanding your colon's health. When doctors perform a colon biopsy, they take a small tissue sample to examine under a microscope. This detailed look can uncover a lot about what's happening inside your colon that might not be obvious during a regular colonoscopy. It's like reading a cellular story that explains symptoms like chronic diarrhea, pain, or bleeding. One of the main things these cells reveal is inflammation. For example, in conditions like microscopic colitis, the biopsy shows an increased number of immune cells called lymphocytes. These white blood cells gather in the lining of the colon, signaling that the immune system is reacting to something. In lymphocytic colitis, there are more than 20 lymphocytes per 100 epithelial cells, which points to immune activation and inflammation. Another important feature is the thickness of the collagen layer beneath the lining cells. In collagenous colitis, a subtype of microscopic colitis, this collagen band becomes thicker than normal. Usually, it's about 3 micrometers thick, but in this condition, it can grow beyond 10 micrometers. This thickening disrupts normal colon function and often causes symptoms like persistent diarrhea. The surface cells, called epithelial cells, are also examined closely. Damage or detachment of these cells can indicate ongoing injury or inflammation. Sometimes, the cells show signs of stress or repair, which helps doctors understand how the disease is progressing or responding to treatment. When it comes to colon cancer, the biopsy cells reveal even more critical information. Pathologists look for abnormal or cancerous cells, checking for signs of dysplasia, which are precancerous changes. These cells may have irregular shapes, larger or darker nuclei, and uncontrolled growth patterns. Detecting these changes early is vital for staging the cancer and planning treatment. Biopsy samples can also show structural changes in the tissue. For example, the architecture of the colon lining might be altered, with tears, nodules, or unusual blood vessel patterns. These signs can help identify different diseases or stages of disease progression. Most importantly, these microscopic findings guide doctors in diagnosing conditions that might not be visible during the colonoscopy itself. For instance, microscopic colitis often shows no visible abnormalities during the procedure, but the biopsy reveals inflammation invisible to the naked. This makes biopsy an essential tool for accurate diagnosis and effective treatment planning. In summary, examining colon biopsy cells under a microscope reveals inflammation, structural abnormalities, collagen changes, and cellular atypia. These insights are crucial for diagnosing and staging conditions like microscopic colitis and colon cancer. They help doctors understand what's happening at the cellular level and guide appropriate treatment. If you ever need a colon biopsy, remember that this tiny tissue sample holds a wealth of information about your colon's health. Always consult with healthcare professionals for personalized advice and follow their guidance for diagnosis and treatment.